Welcome back, Dr. Watts again, Wednesday, January 11th. Okay, last week we spoke about carpal tunnel. Today we're going to talk about plantar fasciitis. Okay, very similar injuries in that in a lot of cases they are both overuse injuries. Okay, so first off we're going to talk about what are some of the symptoms of plantar fasciitis. Okay, two of the main ones are pain in the arch of the foot and pain in the heel. Okay, usually that heel pain, most patients describe that as feeling it as the worst first thing in the morning. Okay. So what are the causes of it? What causes plantar fasciitis? Well, there's a list of things, and depending on you specifically, would depend on what caused your plantar fasciitis. But I'll list off kind of a number of things, and this may or may not apply to you, okay? Athletes, playing sports, they could have injured it doing that. Arches, so if you have too high of an arch or you have no arch, you have flat feet, that can cause it. Or weight, if we're overweight, that can be a cause. Shoes are a big one. So are your shoes too small? Are they worn out? Do you wear high heels? Okay, so there's a number of things when it comes to shoes, all right? Also, calf injuries as well can cause problems down below, okay? So calf, Achilles tendon, plantar fasciitis, all those are in a way connected, and depending on what you specifically have would depend on if that is your case, okay? So treatment-wise, what do you do for treatment? Well, we do, once again, a number of things. We can do ultrasound, we do cold laser, myofascial release. We do adjust the tarsal bones in the foot to make sure that you have proper alignment and proper arch in the foot. And then there's some other things that we send you home to do, some different types of home exercises and whatnot. And depending on your case, like if you have an arch problem, we may suggest you going out and getting some arch supports. So very, very specific to the patient. There's no one size fits all for plantar fasciitis, but they still kind of fit in the same realm of around 6 to 8 weeks of treatment, okay? As with carpal tunnel, we spoke about how, a couple times a week, for 6 to 8 weeks, we can get that usually squared away pretty good. With plantar fasciitis, depending on the severity and how long you've had it, it's anywhere from 2 to 3 times a week, okay? One of the things with that is it's hard to stay off your feet, and this is an overuse injury, so sometimes we have to be a little more aggressive with the plantar fascia than some of the other tendinitises like elbow tendinitis, carpal tunnel, shoulder tendinitis, okay? If you have any questions, feel free to inbox us at Dr. Vohn Watts with any questions, or you can give us a call or email us, and we'll be happy to set up a free consultation for you to come in, get checked out, and go from there. So have a great day, and we'll see you next week.